Good afternoon, sir. I am Gerlie Amor Bertulfo from BSN 12J. I'm from Group 17. So my first question is, give the pathophysiology and epidemiology of tuberculosis, typical and atypical, in the ideal way and also based on the family case study here. What are the important nursing care at nursing process during this disease? So tuberculosis is a progressive granulomatous infectious disease caused by the gram-positive acid fast bacilli classified under the genus Mycobacterium. Tuberculosis in human is mostly by Mycobacterium tuberculosis and primarily affects lungs, causing pulmonary tuberculosis. It can also affect intestine, meninges, bones, joints, lymph nodes, skin, and other tissues of the body, causing extrapulmonary tuberculosis. Human TB is transmitted mainly through droplet of infection and droplet nuclei. Tuberculosis causes more than 2 million deaths annually, and the death toll is worsened by the emergence of drug-resistant Mycobacterium tuberculosis. Tuberculosis is a social disease with medical aspects. It has also been described as a barometer of social welfare. The social factors include poor quality of life, poor housing, overcrowding, population explosion, undernutrition, um, smoking, alcohol abuse, lack of education, large families, early marriages, lack of awareness regarding cause of transmission of TB. These factors are interrelated and contribute to the occurrence and transmission of tuberculosis. So in relation sa ato ang case study na the environmental factors is one of the factor that could affect to the family's health. So it was stated here that large family can also be one of the factor. One of the factor. So with that, maka-affect jud siya sa isa ka person or sa isa ka family member or sa isa ka family because kaning environmental factor can affect the person's immune system. So mo ni siya is kailangan jud na ma-aware ang isa ka family or ang isa ka person para dili na magkatag-katag ang bacteria. So the pathophysiology of this tuberculosis. So in addition, tuberculosis is an airborne precaution that can spread by breathing in the same air that an infected person breathes in, especially when the person coughs, sneezes, laughs, sings, and even speaks. So as the bacteria goes inside the lungs, it spreads through the lymphatic system and into the bloodstream. Once the body's immune system is alerted, the B cells will create antibodies against the infection, and the T cells, which are the natural born killers, will attack the tuberculosis bacteria. The macrophages will then make a perimeter to quarantine the bacteria and cease reproduction and growth inside the lungs. Unfortunately, the T cells cannot kill the bacteria. The best thing that they can do is to isolate the bacteria so it cannot spread out. It's like putting the bacteria inside the prison. Captive bacteria are now called granulomas. So moto, na-mention ni Sir Ganiha na ang kaning white blood cell is modyo ni ang nagatabang sa tong immune system para mo fight sa bacteria. So mo ni siya ang kanipong macrophages mo ni pod na ingon pod ni Sir Ganiha na dako pong tabang sa C sa production sa growth sa bacteria sa atong lungs. So, the second question is, in the specific Philippine healthcare setting, how do public health centers and private doctors handle tuberculosis? Compare the two systems and justify your answer. So state and local health departments have the primary responsibility for preventing and controlling TB. So however, TB control is a complex undertaking and requires the collaborative efforts of a broad range of persons, organizations, and institutions, both inside and outside the public health sector. The essential role of the public health sector in TB control is to plan, coordinate, and evaluate TB control and prevention efforts. This role requires that state and local health departments focus and provide oversight of the following critical elements. So first is the planning and policy development. Next is the contact investigation. Next is the clinical diagnostic services for patients with TB and their contacts. Next is the training and education. Next is the surveillance data and information management. And lastly, the monitoring and evaluation. So, we have this, goal na we give the right education, we give the right information, and we should also communicate to our clients. Then we have this the public health centers also have this primary prevention, which stopping a disease before it starts, and this includes the immunizations or the vaccines that na ihatag sa kada person para mo fight sa mga diseases. Next is the secondary prevention, catching a disease before it causes damage or before signs and symptoms begins. So mo ni siya ni mga post-exposure prophylaxis or mga contact tracing about aning TB, mga ingana. So next is the tertiary prevention, reduce complications or damage due to disease process. So mo ni siya ang treatment sa disease like sa TB kung unsay buhaton sa community or sa isa ka family or sa isa ka person. So next is the essential role of the public health sector in TB control is to plan, coordinate, and evaluate TB control and prevention efforts. So while the private doctors have also a major role in providing care to pulmonary tuberculosis parents. So they are the ones who will do the diagnostic assessments and do the right care for the patient. So they have similarities, like they have the goal to help the patient, to help the client in order to not spread the disease. They have the same objectives, and they also educate the patient. So in other words, the health department is legally responsible for ensuring that a complete and timely contact investigation is done for the TB cases reported in its area. So, they also have the same role role as healthcare worker. So, para sila importante, pero na sila yung mga kalahian. Then, ang public health center po di ay is nagahatag ang mga free medication. So, kailangan nimo i-assess ang imuhang patient na dapat imnon jud ang tambal sa kung kanus siya taman. So, naay ginatawag or gimension si Sir ganiha na mga tambal. So, na mga tambal. So, ang na-mention ganihan ni Sir is mote ang rights. So, R stands for rifampicin. Next is I is isoniazid or isoniazide. Next is pyrazinamide. Next is the ethambutol. And lastly is the streptomycin. So, mo ni siya is, mahal jud ni siya. So, kailangan siya ignan jud atong patient na kailangan imnon jud ni siya para na ay mo fight or mutabang sa atong immune system, mutabang na mo fight sa mga bacteria or other agents. So the last one is give a monologue, way of talking, giving of instructions of top 5 nursing actions with rationale. Use actual mother tongue, please, and emphasizing these medications. Give one particular drug example. So first is assess for dehydration. Assess for the status of dehydration, the skin color, temperature, skin turgor, mucous membranes, eyes, crown, body temperature, pulse, respiration, behavior, and weight loss. It is important to assess for dehydration. It's because wala nakakabalo kung okay pa ba ang imong patient. So with this assessment makahelp jud sa iyaha kung unsay nursing management na ihatag sa imuha. So next is observe for diarrhea. Observe for a sudden attack of the diarrhea, fever, anorexia, vomiting, nausea, abdominal cramps, increased bowel sounds, and bowel movements for more than 3 times a day with liquid stool consistency with or without mucus or blood. So, na-mention po ni Sir ganiha is as a public health nurse, if a mother na moadto sa imuha tas mangayo og loperamide, like kailangan nimo i-assess, kailangan nimo pangutan-on na kapila na siya na nalibang, then as advised by the DOH na dili basta-basta maghatag og loperamide kay ang kaning diarrhea nagahelp pud ni siya sa atong body para mawala ang infection or mga bacteria na naa sa atoa. So with this, kung grabe na jud ang pagtae sa isa ka tao, so diha na kailangan mohatag og loperamide para napoy para makastop pud siya sa diarrhea kay basin ma-dehydrate na pud ang atong patient. So mo na siya. So assess the level of knowledge of the family. Assess for the knowledge of diarrhea at home, dietary knowledge about the prevention of recurrent diarrhea. So mao to akong giingon ganiha. Dapat kabalo siya kung unsay buhaton pag nagka-diarrhea ug unsa poy tabang pod na kaning kumalibang ka like like twice a day lang or ingana. So iingon mo na maka-help pud ng paglibang maski ingana lang kay para ma-wash out pud ang mga infectious ay mga bacteria. Next is give anti-diarrhea medication. This is to fight the bacteria. And lastly, monitor intake and output to know if the patient ensure that the patient has proper intake of fluid and other nutrients. So, muna siya. So, next is my example na medication. Ani is loperamide. So, loperamide acts by slowing intestinal motility and by affecting water and electrolyte movement through the bowel, and it is an antidiarrheal agent. So, for example, maghatag og example, I'm a community health nurse, then naay isa ka bata or duha ka bata na nagka-diarrhea. So, ang mother ni ato sa ako, nangutan na nurse, ana, kanang, five times a day, tae ang iyang mga anak. So, as a nurse, I will ask her na unsay cause anang iyang diarrhea, then kanang mag-teach ko kung unsay buhaton na kung ingana 5 times a day sila 5 times a day sila nagatae. So tudluan nako para dili ma-dehydrate ang mga bata, tudluan nako ang mother na paimnon silang tubig para ma-rehydrate ang mga bata. Then tagaan nako sila og loperamide para mag-stop na ang stop na ang diarrhea sa mga bata kay enough na pod ang 5 times a day na nagatae sila, enough na para magawas nila ang mga ubang bacteria o para ni maka-help pod sa immune system sa mga bata na maka-fight sa bacteria. So